Sex is everywhere, but real conversations about sexual concerns, not so much. For many men, premature ejaculation, or PE, isn't just a source of private frustration. It's a mental health issue that can affect self-esteem, relationships, and emotional well-being. Yet it's often misunderstood, dismissed, or cloaked in shame. That's where I come in. As a clinical psychologist, I've seen how silence around topics like PE does more harm than good. So let's break the stigma, unpack the official DSM-5 definition, explore the research, and wrap up with a few mental health tips to support those navigating this deeply human experience. Welcome back to Savvy Psychologist. I'm your host, Dr. Monica Johnson. Every week on this show, I'll help you face life's challenges with evidence-based approaches, a sympathetic ear, and zero judgment. Let's kick it off by talking about what is premature ejaculation. According to the DSM-5 PE is classified as a male sexual dysfunction. To receive a clinical diagnosis, the following criteria must be met. Number 1 is persistent or recurrent pattern of ejaculation occurring during partnered sexual activity within approximately 1 minute following penetration and before the individual wishes it. Number 2 is the symptoms must have been present for at least 6 months and must occur on most, so approximately 75% or more, occasions of sexual activity. The condition causes clinically significant distress in the individual, and also the sexual dysfunction is not better explained by a non-sexual mental disorder, relationship distress, substance or medication use, or any other medical condition. It's also worth noting that the 1 minute benchmark is a clinical guide, not an absolute. Some cases may vary in context, but still cause significant distress. Secondly, there's also some gendered language in the criteria, but understand that premature ejaculation can happen in any relationship. So you may have been wondering, how common is premature ejaculation? Research suggests that PE is one of the most common male sexual complaints. Prevalence estimates vary depending on the population and definitions used, but here are some key numbers. Approximately 30% of men globally report experiencing premature ejaculation at some point. About 1 to 3% of men meet strict DSM criteria, suggesting most cases are subclinical, yet still psychologically distressing. There's also 2 different types of premature ejaculation I want to mention. The first is lifelong PE, and this is present from the very first sexual experiences, and often it has a biological or neurochemical basis. The second one is acquired PE. So this develops after a period of normal sexual function, and it's more likely to be influenced by psychological, relational, or medical issues. Understanding which type you're dealing with can help to guide treatment strategies. Now let's get into the causes of premature ejaculation. There's no single cause, but research points to a biopsychosocial model, meaning it's often a mix of biological, psychological, and social factors. Let's talk about some of the biological factors. One is serotonin receptor sensitivity. Some men have lower serotonergic activity, which affects ejaculatory control. The second is thyroid dysfunction. So you can have underlying medical conditions which can increase sexual sensitivity. And then lastly, genetics. Studies suggest a potential hereditary link to lifelong PE. Now let's talk about some of the psychological contributors. One is performance anxiety. So this is a major driver, especially in new or high-pressure sexual situations. Second is low self-esteem. This can lead to catastrophizing, hypervigilance, or avoidance. So, lastly, a conditioned response. If a man learned to climax quickly, so for example, due to a fear of being caught during their teenage years, that pattern may persist. Now, let's talk about relational and social factors. These can look like a lack of emotional intimacy, communication difficulties in the relationship, and also cultural or religious shame around sex. Premature ejaculation can carry a deep emotional impact that ripples across many areas of life. So, one of those is self worth. Men often tie sexual performance to masculinity, leading to feelings of inadequacy. There can also be relationship strain. So, partners may feel unsatisfied or rejected, creating a cycle of blame and avoidance. Anxiety and depression. So, studies show men with PE report higher rates of depression symptoms, especially if they feel isolated or helpless. And then, lastly, sexual avoidance. Some men begin to avoid intimacy altogether to prevent shame or embarrassment. Now, let's do a broad overview of some of the treatment options for premature ejaculation. The first is general therapy, especially cognitive behavioral therapy or CBT. This type of therapy helps patients identify distorted beliefs about sex, perfectionism, and performance. So, techniques that you might see in this therapy would be challenging shame based thoughts, or learning relaxation training or anxiety management during sex. Number two is sex therapy. So, a trained sex therapist can guide couples or individuals through techniques such as the start, stop, or squeeze method, which can help to slow down the process, communication coaching around sexual needs and feedback, and also exploring emotional closeness and pleasure beyond penetration. Three is medical treatment. So, SSRIs, things like paroxetine or sertraline, these may delay ejaculation by increasing serotonin levels. There's also topical anesthetics, which can reduce penile sensitivity. And then lastly, tramadol. So, that's an off label opioid, sometimes prescribed for PE, though there's a lot of caution here because there can be a dependency risk. Number four is couples therapy. Addressing emotional and sexual dynamics in the relationship can help reduce pressure and rebuild connection. I understand that therapy may take a minute, so here's a few general suggestions based on research. Number one is to talk to your partner even if it's awkward. Silence feeds misunderstanding. Many partners are more supportive than we fear, especially when conversations are honest and not defensive. So, for example, you might want to try, I've been feeling anxious about our intimacy and I want us to talk it through together. Number two is to prioritize pleasure over performance. Many men with premature ejaculation focus so much on lasting longer that they may lose sight of feeling close. Touch, eye contact, laughter, and intimacy are also forms of success. The tip here is to incorporate non penetrative sexual experiences to take pressure off intercourse. Number three is to limit the comparison game. Porn, media, and locker room talk set unrealistic expectations. Most people aren't having porn star sex. Trying to live up to fantasy based norms only reinforces anxiety. Reduce porn use if it increases pressure or reinforces unhealthy sexual scripts. And finally, number four, ditch the shame script. You are more than your performance. Shame thrives in silence. Whether you're dealing with lifelong PE or a recent change, it doesn't define your masculinity, your worth, or your capacity for intimacy. Practice reframing intrusive thoughts like, I'm not a man, into, I'm human and this is a common medical problem. I get it. It can be embarrassing to have this as a chronic or an occasional issue. But wagging your finger at yourself isn't going to make you or your downstairs neighbor stand up any taller. Premature ejaculation is not a punchline. It's not a weakness. It's not the end of a fulfilling sex life. It's a treatable concern that many men face and that most couples can navigate with compassion and skill building. For my take on other sexual health topics, such as understanding desire discrepancies, erectile dysfunction, the fundamentals of great sex, and more, check out the playlist in the show notes. Do you have any sex or relationship questions that you'd like for me to explore? Let me know. You can contact me via Instagram at KindMindPsych or via my email at psychologist@quickanddirtytips.com. The Savvy Psychologist is a Quick and Dirty Tips podcast. It's audio engineered by Steve Rickyberg. The director of podcasts is Holly Hutchings. Our podcast and advertising operations specialist is Morgan Christensen. And Nathaniel Hoops is our marketing contractor. Follow Savvy Psychologist on Apple Podcasts, Spotify, or wherever you listen to podcasts. That's all for this episode of Savvy Psychologist. Thanks for listening, and I'll see you next week.